everyone. Today is World Kidney Day. Every year, the second Thursday in the month of March is celebrated as World Kidney Day. The idea behind celebrating the World Kidney Day is threefold. One, to highlight the importance of kidneys in the maintenance of our general health. Two, to spread awareness among people about kidney diseases and ailments, how to identify. Third, if there are people who are already affected with kidney disease, what they are supposed to do, what advice to follow, and how they can take help. These are the three main reasons. And to spread awareness among people, we celebrate World Kidney Day. Every year since 2006, we have been celebrating World Kidney Day as with a particular theme. There is a broad theme for World Kidney Day, that is kidney health for all. And we come up with a theme every year associated to it. So this year, we have come up with a theme called Preparedness for the Unexpected, Supporting the Vulnerable. So what does this mean? So there are a lot of unexpected things that happen amongst us. If I take the examples of what is happening all around the world, there is war going on between Russia and Ukraine. We recently had a massive earthquake in Turkey and Syria. And the mother of all unexpectedness was in the last 2 to 3 years was COVID-19. And many more unnatural disaster calamities can be an unexpected phenomenon. So whenever there is an occurrence of this unexpected phenomena, how we need to be prepared, and those people who are vulnerable. So with respect to kidney disease, me being a nephrologist, our vulnerable populations are those people who are affected with acute kidney injury, patients with chronic kidney disease, most importantly, patients with advanced chronic kidney disease who are on dialysis, and even renal transplant patients. These are all vulnerable patients who need regular periodic healthcare visits. So whenever this unexpected things occur, they will have to attain or obtain advice in a particular way. So in that scenario, we as healthcare providers at an individual level, at the community level, and at the policymaker level, how we can help ourselves as well as the patients who are suffering with kidney disease, how we can be prepared for this unexpected scenarios is what the theme of this year. So proceeding further, this World Kidney Day is celebrated to create awareness among consciousness about our kidney health. So I will be narrating a few points. See, they call it as 8 golden steps for kidney health. So if you are able to follow these 8 steps, we will be reasonably successful in maintaining our kidney health. So what are those? First and foremost, we need to be active and keep ourselves fit. The minimum recommendation is at least 30 to 40 minutes in a day. And for most of the days in a week, so at least 5 days in a week. So the recommendation says at least 150 minutes per week of activities required. Second, we have to be cautious in what we choose to eat. So eating a well-balanced diet is very important. So we need to avoid junks, eat less salt and sugar as minimal as possible. Third is we need to keep our blood sugar levels under control. See, we are now going to become diabetes capital of the world, and later on will be diabetic kidney disease capital of the world. So diabetes is one of the forefront cause for chronic kidney disease in India. So we should be aware about to get tested for diabetes. And if we have diabetes, we have to make sure that we take medications, and non-medication methods need to be followed to keep our blood sugars under control. Followed by, we need to be equally cautious about our blood pressure. So patients who are hypertensive need to take medicines, or they have to follow the non-medical measures which have been advised to keep blood pressure under control. So along with this, what all we need to do, we need to get periodic health checkups. So a person who's at risk for kidney disease, like the one who is having recurrent urinary tract infections, who has a family history of kidney disease, they have to be more cautious and be very careful about their kidney health and get a regular checkup done. And if they have the disease, then take measures for early prevention and mitigation of the illness. There are certain habits which are very deleterious to our kidney health, and the most important of that is smoking. So quit smoking is very important. And for those patients who have already turned out to be having kidney disease, they have to get regular checkups done. The few tests that I can mention is kidney function tests or renal function tests. You might have commonly heard of creatinine, isn't it? So it is one of the common renal function tests. Then urine tests and sometimes ultrasonogram to know what is the status of our kidney disease. And we can, with following these 8 golden steps, we can keep our kidneys healthy. And those who have already been patients of kidney disease can take adequate measures and keep the disease well under control. So now, as I've told you about what are the preventive measures and general health to keep our kidneys healthy, general measures to keep our kidneys healthy, a few words for patients who have already developed a kidney disease, more so have already developed kidney failure. So those patients who have already developed kidney failure, please don't think this is not the end of the world. In today's scenario, there are a lot of options post kidney failure. That is completely your kidneys are functioning minimum. There is hardly any work going on. So the common thing which you have heard about is dialysis. So there are 2 forms of dialysis. One is hemodialysis. The other one is peritoneal dialysis or continuous ambulatory peritoneal dialysis. Hemodialysis is one where the blood is removed from the body, passed through a machine, through a dialyzer, and returned back to the body. Whereas peritoneal dialysis is where you pass some peritoneal fluid into the abdomen cavity, you leave it some time, and after the procedure is complete, the water is drained out. And this happens 3 or 4 times in a day based on what your doctor prescribes. And this can be done at home. I agree. A lot of help is required in this method of dialysis, but many patients are very comfortable in continuous ambulatory peritoneal dialysis. Having said about dialysis, is there any other option? Definitely. And the best form of renal replacement therapy is renal transplantation. And with the advances in renal transplantation, now the living donor pool is being expanded with ABO incompatible transplant, swap transplants, and so on. And there is one more most important thing that we have to keep in mind is cadaver transplant. So after death, rather than putting our body into the soil or into the fire, it's better that we all donate our organs. So on this World Kidney Day, I pledged to donate my organs post my life if there is an opportunity. With these words, I again wish everyone a good kidney health to all and wish us on World Kidney Day 2023. Namaste.